Hi, everyone. Welcome to this webinar on the Master of Epidemiology from the UQ School of Public Health. My name's Emily Dieter. I'm an infectious disease epidemiologist, and I'm also the director of the program. I work here at the School of Public Health, where we aim to work together to improve the health and wellbeing of populations in a changing and inequitable world. So that's what we all aim to do while we're working here as a big team. I'd like to start today by acknowledging the traditional owners of the land on which we meet today, wherever you may be watching this from. And for me, that's the Turrbal and Yagara people, and I'd like to pay my respects to elders past, present, and emerging. I'd also like to highlight UQ and also my own personal commitment to diversity and inclusion. So here we Sorry, I apologize. So diverse perspectives, abilities, experiences, and backgrounds inspire creativity, encourage innovation, and enrich our communities. Members of our broad community are valued and respected for their individuality. UQ strives to create a culturally safe, welcoming, and inclusive workplace with strong community connections and partnerships. And I certainly am also very committed to that. So we're here to hear about the Master of Epidemiology. So what do epidemiologists do? And the study of epidemiology, as you can see written here, is the study of the distribution determinants of health-related states and events in specific populations. And really what that means is we look at the spread of disease, so how many people might be sick, and if that's specific populations and where they might be based. And it's also around what makes people sick. So what are the drivers that are causing people to become ill? And then leading on from that, we can even go so far as to look at intervention. So we could look at things before and after. So it's not just what makes people unwell, but we can look at things that might make them more well. And I think for me, I always like to tell the story about how I started in epidemiology, because I think can be some confusion about what it might actually look like to be an epidemiologist. And so I started out doing a general health science degree, and I wasn't really sure what I wanted to do, but I had a real interest in population health and marginalised populations and resource poor settings. And so for my honours year, I was part of a team that went over to the Pacific, and I helped implement HIV behavioural surveillance surveys. So there was lab testing and also some behavioural surveys with that. And then when I came home from that trip, I had all this data to analyse. And for me, I hadn't really done epidemiology before. And I didn't think I was necessarily a stats or maths type person, but because I had been out collecting the data, the people were real to me. Like, I had seen the effort they had put in to provide me that information. So I really studied hard to try and understand how to use that data appropriately, since people had really taken time out of their lives to provide it for me. And so for me, yes, there are some stats and numbers involved in epidemiology. But if you have a real interest, I think, in problem solving and providing an evidence base, that's more important, and you can learn those other skills. So really what epidemiologists do is provide the baseline data that all other public health rests on. And for me, that's really exciting. I like providing evidence for people that can actually use it to make a difference in the world. So even if you think about a health promotion program, it might use, or often does use, epidemiology to start with, because we might be looking at which populations are most affected so that people know where to target the health promotion interventions. Or if a vaccination program is put in place, we need to look at whether that's effective or not. So looking at rates of vaccination and also disease before and after an intervention. So really providing an evidence base is what it's all about. And it can lead to a range of different careers, generally an epidemiologist, but that can look very different. So I think sometimes in the Master of Public Health, students feel like they're not sure what will happen at the end of their degree. And I would suggest epidemiology is a more specific skill set, but it also, I guess, means that you don't have such broad options, but the options you do have you will be well trained for. So Things like, so I'm an epidemiologist, I work at a university, I do teaching and research, but before this I used to work in health departments. So I used to work for something called AusFoodNet. So I used to work in health departments around Australia, investigating outbreaks of disease, really. I have friends who work in program evaluation, people that work overseas for different organisations, and what else? Consultancy definitely is becoming more of a thing. We definitely have some students who are consultants. We have students that are working in public health units. And I think more and more there's also this real growing interest from industry. So not just things like vaccination or immunization companies, but things like medical devices or a lot of AI type startups that might be health-based. So there really is sort of a range of what you might decide to do when you leave. And I think also thinking about the context. So you'll be working with numbers, but what diseases might you be focusing on? You know, looking at chronic diseases is very different to looking at infectious diseases. So, and for me, I did my PhD in vaccine preventable diseases in older Australians. And now I guess I've pivoted a little bit in terms of looking at how we can better use digital methods in epidemiology because of some opportunities that I had. So I think you never know where it's going to lead you in it. I think it's a really fun job. So the important features of our Master of Epidemiology are that it's an accredited 2-year program. So you'd be studying for 2 years. And there is flexibility to tailor the degree to reflect your interests and professional aspirations. So I will go through next what's actually in the degree. And we have a number of core subjects, but then there are also options for you to tailor around this. So as you can see here in Part A, these are our core courses. It includes things like Foundations of Public Health, First Nations Health and Wellbeing, which perhaps sound less epidemiology focused, and they're more broader public health subjects. But I think the reason that we now include these is we did a large program evaluation of the Master of Epi, and when we spoke to stakeholders, they were suggesting that perhaps some of our graduates didn't have the broader contextual knowledge working within public health. And as an epidemiologist, you're going to be working in public health in some kind of way. So really ensuring that you've got those foundations of broader public health. But then, as you can see, the rest are really looking at epidemiology, so intro to epidemiology, intro to biostats, and then we have some more advanced courses as well. Now, the time that you can actually really tailor the degree is through your capstone dissertation and also through your electives. So this is an example of some of the electives. And I will say Foundations of Digital and Clinical Informatics has been very popular. And I think that's a really emerging area. It's going to, you know, the more and more we're using digital methods, it's really going to be more and more important. We also have Public Health Connect, where students can work as consultants on a real-world public health problem. And some other options there. And this isn't an exhaustive list. And then the dissertation is really where you can choose something that you're really specifically interested in. You don't have to. So there will be a list provided of possible projects that supervisors in different workplaces have put forward that you might want to choose. But if you've got a really specific area of interest, then please always, you could come and talk to me and we could try and figure out, you know, if there's someone within our contacts or colleagues that might have something that fits into that. And the other thing that we're really trying to do in the last few years is integrate these with practice. So a lot of our students actually go and do their dissertation with a public health organisation outside of UQ. And so that's also another opportunity for you to, you know, meet people in the field and gain further experience in a specific area that you might be interested in. So I've told you all these wonderful things about epidemiology. If you want to apply, what does that look like? So you will require a bachelor's degree in a relevant discipline. If it's not in a relevant discipline, you must have that plus 1 year of full-time relevant work experience. And that really is in a research or healthcare type setting. But the other option is that we also have graduate certificates and graduate diplomas, which you can start on. And then if it's something that you're enjoying and liking doing, then you can increase up to a master's if you choose. And so you also do need to have a grade point average of 5.0. And for this year, the semester one intake for next year will begin at the end of November. And then Lachlan was going to do these last slides for me, but he's not here, so I will have a go. So this is really just showing the process for any degree that you want to enroll for at UQ. But if it was the Master of Epidemiology, so you would choose the program, look at whether you're eligible, and then go through the actual application process. If you ever want to make a change to your application, you can ask a question. So there's a UQ Apply that has a messaging function, and that's all available online. And you need to upload a supporting documentation for an application at any time. So you don't need to wait till the very end. You can do that earlier. The other thing I think to mention is if you have any questions about this process, you can always send an email, and I'm also happy to take questions at any time. And finally, I just wanted to note the Commonwealth supported places. So some programs have places that are partially funded by the government, and then that is paid back, which most people know as HECS or HELP. And so we have some places where we have HECS and HELP available, and you would be required to repay the remainder of the fee for each course that you're enrolled in. But again, the application team can tell you more about this. This is also something that might be a bit more of interest later when you're actually studying, but these are a lot of different opportunities through UQ to really integrate, not integrate, that's the wrong word, but to get more experience and put you in the best position moving forward into your career. So these are all available through UQ, and I would highly encourage you to look for any of these and get involved. So I'm not going to go through all of these. I'll just leave it up for a minute in case anyone wants to read, but these are the key dates for 2024. And that's all I have for today. So thank you very much for listening. I hope it was useful, and please know I'm always happy to have a discussion, organise a time to Zoom if you have any specific questions, or you can email if you don't really want to Zoom. I'm more than happy to take questions at any time. So please, if you're interested, do get in touch with me. Thanks so much.